Hi, my name is Carly Sewell.
Hi, my name is Jordan.
Hi, my name is Grace.
Hi, my name's Megan.
Hi, I'm Emma.
Hi, my name's Savannah.
And we are group 4. Our case study is over a sensorineural hearing loss, and we decided that it is a cochlear pathology finding.
So our patient, he was a 60-year-old male who worked in construction from a very young age. The reason for his examination was a sudden hearing loss. He has a history of Meniere's, which is an autoimmune disorder. He was prescribed prednisone pretty often, which is a steroid, and it acted as a Band-Aid for the hearing loss. He was also prescribed a chemotherapy medication, and 2 years later, after the chemotherapy medication, he was vaccinated for the influenza virus and shingles and had a return of the hearing loss, and therefore had a return of the prednisone to stop the hearing loss.
So in our case study, the findings were that the vaccinations affected his hearing. So we presumed that the significant construction noise correlates with the decline of his hair cells, which leads to his immune system weakening. And then we also noticed on the audiogram that at the 4,000 hertz notch, it was vastly below the normal standards.
So here we have 2 audiograms. The one on the left is from 2002, and then the one on the right is from 2017. So on the left, you can see that his hearing is pretty much normal. He does have a little bit of a loss in the higher frequencies, but that isn't anything that really affected him too bad. He might just miss out on some consonants and things like that. And then, of course, on that audiogram, his tympanogram was normal. And then on the right, about 15 years later, you can see a major decline in his hearing, especially in the higher frequencies. And this is 15 years later after he's had all of these things going on. So you can also see that on his tympanogram, on his left ear, there is a type AD, which can sometimes be consistent with issues with the bones in the middle ear or just any other kinds of things going on. And so that could be relevant, but it's not a whole lot to help diagnose anything. It's just something to note. So really what we're paying attention to here on this audiogram is the decline in his hearing.
The influenza vaccine weakened and overstimulated our client's immune system, causing ototoxicity to occur. This is when a person develops hearing or balance problems due to intake of medicine that damages or weakens hair cells in the inner ear. Damage can result in mild to profound hearing loss and may include tinnitus to occur, which is ringing in the ears.
So most of you already know how auditory processing works from taking audiology. So this is just kind of review. But the hair cells receive the auditory information and they send it to the cochlea. And there are 2 types of hair cells, inner hair cells and outer hair cells. Inner hair cells are responsible for conveying like the actual transduction process, the actual auditory stimuli, and they convey place and timing. Whereas outer hair cells are responsible for like amplifying the sounds by moving the tectorial membrane downwards so that it can actually stimulate those inner hair cells. And once the hair cells have been stimulated, the auditory nerve sends signals from the cochlea to the brainstem, which will eventually end up in the auditory cortex, which then recognizes the sounds, and processing occurs from there. This is just a visual representation of the hair cells and the tectorial membrane within the cochlea. So as you can see, the inner hair cells are those tiny little guys that sit lower than the outer hair cells, which are like the workhorses that pull down the tectorial membrane to stimulate those inner hair cells.
Okay, so for our 2 questions, the first question was about how the vaccinations triggered a hyperfunctional immune response. And we hypothesized that this was caused because since our patient already had a autoimmune disease, we think that the vaccinations further weakened the immune system, but it caused a hyperfunctional immune response by overstimulating the patient's immune system, which harmed the hair cells, resulting in that hearing loss. And all the times that he took the prednisone for the effects of the hearing loss, we think that it acted as a Band-Aid, and it didn't really ever improve the function of the hair cells. It really just gave them that that response, that stimulation that they needed. But then once the steroid wore off, they did not have that stimulation anymore. And then our second question was, how is it that he managed for so many years without showing signs of noise exposure, only to have them emerge as a result of autoimmune disease? And so we think that because he used hearing protection, because he didn't have any head trauma, he didn't have any ear surgeries, infections, that's why he had the normal audiogram. And he didn't start showing these signs of presbycuteness until he was 61. And we think that it was because of the Meniere's, because this made the individual's hair cells more vulnerable to that immune attack. And since it's in the 4 kilohertz region of the tympanogram, that is the classical age for noise-induced hearing loss. So the individual did not start practicing the needed precautions to help his hearing from the construction noise until he was like later in life. So we think that those hair cells were very susceptible to a lot of damage during those construction years.
Our reference that we used was our neuroanatomy textbook, and if you have any questions about this matter, please reach out to us.
Thanks.